Hi everyone, welcome to our first Dementia and Brain Health webinar. My name's Amy and I'm from Fortis Consulting, PICAC's provider in WA. Today we will unpack the myths of dementia and discuss what we could do to reduce the risk of getting it. Today's webinar is an introduction to brain health, why it is important, and its connection to reducing the risk of developing dementia, whilst also giving a few easy steps to start your brain health journey. Cognitive and memory decline is a common health challenge as we age. Firstly, let's address the elephant in the room. Are you worried about getting dementia? We'll start by clarifying a few myths that honestly make most people a bit nervous. Myth number 1, you think that dementia is just a part of getting old, that you'll get it too when you're older. Dementia is not a natural part of getting older. Most people do not develop dementia as they age. In 2023, there are up to 400,000 people living with dementia in Australia, and this number is expected to increase to 800,000 by 2058. But for perspective, looking at the 2021 census data, there are over 2.65 million people over the age of 65 in Australia, meaning that less than 15% are living with dementia. Myth number 2, my mum has dementia, so I'm definitely going to get it too. This isn't true either. Although there may be a genetic component in some forms of dementia, most cases do not have a strong link. So just because your parent has had it does not mean that you will get it as long as you take care of your brain health. Number 3, I'm becoming forgetful. I think I might have dementia. Although memory loss is an early symptom of dementia, we all forget things occasionally. When it's starting to significantly affect your everyday life, then that's when it's best to go get checked out. Number 4, you can prevent getting dementia. Unfortunately, this one isn't true. There is no current cure or prevention for the condition. However, the good news is that there are certain things that we can do to reduce the risk of getting dementia, and brain health is a key factor. A lack of dementia awareness and education is a major cause of stigma in all cultures. However, it is more prevalent in some, and dementia is usually described and judged on the basis of its symptoms. For example, memory loss or a simple misunderstanding can sometimes be described as craziness or mental illness and judged negatively. For some, having the condition themselves or to have a family member with dementia can lead to shame and isolation in families and communities. Many people in those cultures are unaware of the link between brain health and helping to prevent brain health decline. Take a look at the below examples of what people call dementia in different languages and what they mean, and think about how this might affect a culture's understanding and perception of dementia. The first example is an Arabic word, which means to lose your mind. The second word, in Serbian, means evaporated. And the third is a Turkish word, which means second childhood. The terminologies used for dementia can cause significant confusion and misunderstanding, and changes how people will treat those living with dementia. So, what is dementia really? Dementia is used to describe a wide range of specific medical conditions which are caused by damage to brain cells. When the cells can't communicate normally, our thinking, behaviours and feelings can be affected. For example, Alzheimer's is the most common form of diagnosed dementia in Australia, with around 70% of those with dementia receiving an Alzheimer's diagnosis. The brain region called the hippocampus, our centre for learning and memory within the brain, is the first region of the brain to be damaged, and that's why memory loss is one of the earliest symptoms of Alzheimer's. Anyone can develop dementia, and it is true that the risk of dementia diagnosis can increase when we age. There is also a number of factors that can increase our risk of developing dementia, and these can be genetics, lifestyle, or health factors. Even children can get dementia in what is known as childhood dementia, and for those aged under 65, it is called younger onset dementia. It can be hard to get a diagnosis of dementia, and we should recognize some of the symptoms, such as comprehension, a struggle to understand what is being said to you or what you're reading, making poor judgments in situations, getting lost and not being able to follow directions or recognize where you are, changes in your personality or behaviors, being unable to manage your finances and understand how to use money, and not being able to learn new skills and struggling with understanding. Even though there is no cure for dementia, there are things we can do to reduce the risks of getting it and to slow the onset of symptoms. So, what can you do to help your brain? You can keep your heart healthy, as heart health and your brain are linked. Generally, what's good for your heart is good for your brain. We know what habits put heart and general health at greater risk, and these include smoking, excessive drinking, having a diet of high cholesterol, sugar, and unhealthy fats, as well as just not getting enough physical activity. It's not easy to change a lifestyle overnight, but we can always make small steps to try to live a lighter and healthier life. If you like to walk, then try to get some extra steps in every day and make it a habit. Eating healthy does not mean you need to say goodbye to all the food you like, but have some moderation in the unhealthy foods you eat. It's about making friends with food and learning to listen to your body. If you are struggling to eat healthy, talking to a dietitian or nutritionist is always helpful. Research from Harvard University has shown that the best brain foods are the same ones that protect your heart and blood vessels, such as green leafy vegetables, fatty fish, berries, tea and coffee, and nuts. Secondly, we can challenge our minds. The idea of brain training is based off the concept of you use it or lose it. More of the brain quizzes and stories, being more active, taking up new skills, languages, crosswords. The more regularly you challenge your brain, the less likely you are to experience cognitive impairment and a general reduction in your ability to remember and learn new things. This also affects gaining dementia in your later years. More activities include reading, listening to the radio, visiting museums, learning a new skill, playing music, board games. All of these are great exercises for your brain that create new neural pathways. Number 3, be a social butterfly. As we get older, it can get pretty isolated, especially during winter months where we want to hibernate. It takes more effort for us to get out and about, but generally being socially connected with other people involves many cognitive functions that we want to save, such as thinking, feeling, sensing, reasoning, and intuition. Social activities help build up a reserve of healthy brain cells and promote the connections between brain cells. Being supported in your social group may also encourage healthy behaviors such as exercising and eating healthy and just generally boosting your mood. Social isolation and loneliness are found to increase the risk of getting dementia by up to 50%. Older people from culturally and linguistically diverse communities are more likely to experience social isolation as well. This could be a number of factors, including that they came to Australia with their children, but the cultural shock has made them feel lost, disconnected, and their English proficiency might restrict them from making friends, or they can't find anyone to do activities with. If you have become isolated, consider ways you can reconnect, rekindle a relationship with old friends, join a group, or if you can't get out of the house, use technology to reach out. If you are stuck for resources, contact your local PICAC and they will connect you to where you can find this information. Many local councils and libraries provide social groups you can connect with. If you are accessing the aged care system, such as through the Commonwealth Home Support Program or home care packages, you may be entitled to access supplemented social support with some Commonwealth funding. Your provider can give you more information or reach out to the My Aged Care team. So, just to recap on today's content, dementia is not a natural part of aging. Memory loss is a symptom, but we all forget things occasionally. There is currently no cure or prevention for dementia, although some new advances are being made every day. In the meantime, we can reduce our risk by using some brain health strategies. Steps we can take include checking your heart health, increasing physical activity, eat foods that are good for your brain, Challenge your brain every day with new information and engage in social activity. If you are worried about potentially having dementia, please go get it checked out with your doctor. There are many resources you can access online or over the phone. Please pause here and note the below helplines and pages. But we do thank you for attending today's webinar, and if you have any queries, please call or email us and we'll be happy to help also. The next webinar, running in a few weeks, where we will explore more on how people view dementia in different cultures, where the discrimination and stigma can come from, and what we can do to challenge the false assumptions and beliefs. Thank you, and see you next time.